Hi, I'm Dr. Naomi Gregory, and the purpose of this video is to try and dispel some of the misunderstandings patients have about balloon sinuplasty. Those seeking relief from their chronic sinus problems have probably already explored a vast array of treatments and might be wondering if surgery is their last option. Balloon sinuplasty is a procedure that allows some chronic sinus issues to be cleared up without invasive surgery, often with a recovery time of just a day or two. Unfortunately, because the procedure is still relatively new, there's a lot of myths surrounding it. So here's some that I've encountered in the office. Number 1, sinus surgery doesn't even work. The fact is that the vast majority of patients that have sinus surgery or balloon sinuplasty have significant improvement in quality of life. In recent analysis of 45 separate studies, all of those studies showed a significant quality of life improvement in anywhere from 77 to 97% of patients after having surgery. Myth number 2. Balloon sinuplasty doesn't work as well as surgery. Both balloon sinuplasty and conventional sinus surgery have the same goal: to widen the narrow sinus drainage pathways. Surgery achieves this by cutting tissue, while the balloon expands and restructures the bony opening. In-office balloon sinuplasty is a safe and effective procedure. There are studies that show that the balloon procedure is as effective as surgery in terms of patient quality of life outcomes. Other benefits of balloon dilation compared to surgery are less bleeding, reduced use of postoperative pain medication, faster patient recovery, and fewer postoperative debridements. Number 3. Balloon sinuplasty will not be covered by my insurance. The fact is that both traditional sinus surgery and balloon sinuplasty are covered by the vast majority of insurance plans. However, there are a few plans that still do not cover the balloon sinuplasty. Depending on your plan, there may be a pre-authorization required prior to the approval of the procedure. The office which you are receiving care will help guide you through this process. Number 4. Every patient is a candidate for balloon sinuplasty. The fact is, unfortunately, some patients have severe structural issues such as a deviated nasal septum or large nasal polyps, which make accessing the sinuses with the balloon really difficult. Other patients may have fungal sinusitis. All of these folks are best served by traditional sinus surgery done either in a hospital or ambulatory surgery facility under general anesthesia. Number 5. I'm too sick to have surgery, so I can't have balloon sinuplasty. Some patients might not be a good candidate for general anesthesia, but might still be able to have balloon sinuplasty. Whether it's because they cannot stop certain medications, like blood thinners, or are simply too sick to undergo general anesthesia, we can often proceed with the balloon sinuplasty in the office setting. Number 6. Balloon sinuplasty will change the appearance of my nose. While you may have some mild swelling, there will be no changes to the appearance of your nose after this procedure. If you do feel a little bit swollen afterwards, I encourage patients to sleep with their head elevated 45 degrees or wear cold compresses over their eyes. Myth number 7. I will have black and blue eyes. This may be seen when the nose is broken or after rhinoplasty, but this is not the case after balloon sinuplasty or traditional sinus surgery. Myth number 8. My nose will need to be packed. The fact is that sinus surgery has changed a lot and used to involve surgeons packing gauze into the nasal cavities and then removing it a few days later. This could be very painful, but now we rarely pack a nose. We have other types of materials like foams and dissolvable packing that can do the job of controlling bleeding and preventing scarring even better. Finally, myth number 9. Recovery will be painful and difficult. While sinus surgery in the operating room usually requires 1 week of recovery, most patients undergoing balloon sinuplasty can be back to work in 1 to 2 days. And less pain medications are needed after balloon sinuplasty as compared to sinus surgery in the operating room.